Thank you, everyone. That's very helpful because I like to, if possible, personalize some of my talking points as I give you kind of a background on at least what my vision is as a new director of corporate reputation and thought leadership at Blue Shield of California, and how I take, my previous role and responsibility as California's former health equity officer with the State Department of Public Health. And obviously, I'm not officially in that capacity. However, with now 20 years working in the healthcare industry between the state, now with Blue Shield, Sutter Health, and with Kaiser Permanente, each of those organizations has a critical role to play in advancing a health equity agenda in our state and across the country. And the unique opportunity here at Blue Shield of California is that our team of corporate reputation and thought leaders didn't exist. This function as a part of our external affairs component of Blue Shield of California, it didn't exist. It did some baseline reputation work to get a sense of what can Blue Shield of California do to move forward to enhance and strengthen and sustain reputation, and how can we demonstrate thought leadership across the country for the general public, for opinion influencers, and different key stakeholders that we have. So I find myself in a role, just like I was in the previous role, something that's new, something that didn't exist, and that we're building up in a way to add value within a very strong organization with a social mission, a commercial nonprofit entity as Blue Shield of California. And the importance of this conversation that we're having today, and also as we change seats in our various career paths, the cause of health equity should not escape us. So my perspective in this role of thought leadership and corporate reputation with Blue Shield of California that has an opportunity to officially define a position and demonstrate competitive advantage around health equity is to bring that more to the forefront and help that be more defined, not just for socially, morally, and ethically important reasons, but really the broader message I want to share with you as we wrap up today is, as I mentioned before, there's the domestic, there's the economic business growth opportunity that is imperative, particularly in a country and a state, as I said earlier, that is diversifying as rapidly as we are. So many of the great examples that we've seen today, whether it's the LA County examples, LA Care, American Heart Association, it's a deep, culturally congruent understanding and a bilateral relationship we have with communities that we live in and that we work with. We don't have a top-down approach. So when we think about upstream institutions, corporate structures, systems, policy makers, it's about taking what we've learned in kind of these smaller ecosystems, if you will, and then going upstream to hardwire those in places like in LA County or Blue Shield of California in a USC. And that's why I use the wind turbines as just kind of a visual example, because with regard to health equity, they may not always need to see us, but they should feel us. What turns those turbines you don't see, but it's very much so there, generating energy, electricity, power. And that is a part of my messaging internally, like I said, week 7, of how do I, in a seamless way, position this cause of health equity, understanding that conversations for some around health equity, it can be more challenging given their lack of understanding, their positive ignorance of just genuinely not knowing what health equity is really about. Then you have those others who are more conscious about their opposition to what they think health equity is. And like I said, those who just simply don't know that, or they think they're confined to, oh, equity, that's that state government stuff, or that's for the poor people or the disadvantaged. That's a piece of it. But it's how do we go upstream and change a mindset to help people understand that from a multicultural standpoint, when we think about income and the growing income gaps, when we do comparisons of lower income, middle income, upper income analyses, when we look at people coming to our state from all over the country, all over the world rather, all of the unique dynamics, you need to understand the demography so that we can cater from a business standpoint to what their needs are. Otherwise, regardless of what industry you're in, you'll become extinct and irrelevant. So the importance of us being engaged in a meaningful way around health, mental health, equity, and a broader well-being, and even to take it to another level of just the broader sense of social justice, economic justice, environmental justice. The importance of that is that internally within Blue Shield is I'm objectively trying to position a new initiative that should affect the business of growing, which is a responsibility that we have as the third largest health plan in the state, second only to Kaiser Permanente and Anthem Blue Cross, no affiliation. Blue Shield is completely separate. It's different in different states. But one of our goals is to grow from 4 million. That's core to our business as a commercial nonprofit. But we're not segmenting currently, as I see it. We're not understanding very well the demographics, the market demographics across the state. What's going on in the Central Valley? Whether it's social issues that keep people unhealthy, whether it's the economic issues that range from agriculture to technology that integrate the both. It's more than just San Francisco Bay Area, it's more than just LA. What's going on in the border region between San Diego County and Mexico? Having a market analysis mentality that infuses equity into it, because given multiculturalism and all the other pieces that I mentioned, in order for us as a company to be relevant, to be competitive, we have to have a strong position with regard to health equity, integrate that and infuse it across the various business sectors of Blue Shield of California, so that the work that they feel, but they may not necessarily see, is really about, it's the takeover that they didn't know was coming, like Pinky in the Brain. It's like we position ourselves strategically as thought leaders, as folks with a strong reputation as a company, to empower others around us, because we can catalyze a movement. If you look down south, the civil rights movement, a handful of people, what they were able to do to really deconstruct a wide array of policy and culturally, detrimental dynamics that have suppressed and oppressed many people. We've got a long way to go, but a handful of people that kickstarted that movement started something that we all benefit from today. So if we take on that same mentality in our respective organizations and figure out how do we cater a message unique to the audience that we're trying to compel to do something, to embrace the call for health equity, to take action that moves forth a social, moral, ethical, and an economic agenda, thinking about how do we uniquely position ourselves with messages, with data, to move folks from A to B to C. That in synthesis is what I'm doing within Blue Shield of California. Getting settled in. It's not all about equity, but it is, as far as engaging with our IT folks, engaging with our markets folks, engaging with our diversity and inclusion employee resource groups, and empowering them with partnership to elevate the work that they're doing, working with our foundation, the Blue Shield of Community Foundation, led by Dr. Peter Long, the great work that they're doing, the great work we're doing on the corporate side around corporate citizenship and corporate social responsibility, the work that we're doing with our government sectors and government partners, seeing basically the whole terrain of Blue Shield of California, LA County, USC, the FQHC, our safety net partners, community health centers, taking some of our international and global perspectives of best practices. I've been to Cuba twice on 2 health equity research trips, and what I learned there is a lot of really, really good information that's deeply rooted in prevention and going upstream, things that we can learn to apply to many of our systems. But taking your unique role and ability to change your organization and to make equity de-siloed and seamless and something that people feel even though they may not necessarily see it. So I wanted to do something a little bit differently and not just bore you with another presentation, but that in essence is what I'm trying to do with Blue Shield of California, among other things, position us to have equity as a seamless value within our organization that allows us to demonstrate our commitment around our social mission, but to also understand that it has to be a vital component of our growth strategy as a business. It's okay for us to be in business as a commercial nonprofit. However, we need to have an authentic commitment to a workforce that reflects the demography of the state of California. And oftentimes that's not the case, not just for us, but if we look at the state of California, when I was at the State Department of Public Health, there was some diversity among entry-level opportunities. But for the 4.5 years I was there, up until March 2nd, I was the only African-American man ever in any of our executive management team meetings. And I never had an African-American female peer. We had one Asian-American deputy director. We had decent diversity around gender representation as well as sexual orientation. My point is, when you get to influential positions, the governance structure, your boards, your C-suite, if your workforce, in addition to needing to have a strategy that's externally facing, that extends to multicultural and very diverse groups, even when that's in place, and Starbucks, once again, coming back to that, is a good example. I'm not a coffee drinker, I never have been. But one of the big challenges, the real-time example, is I really appreciate how they stepped up and took responsibility. The CEO, Kevin Johnson, stepped up immediately and took action to intervene in that instance. Then you go to their website and you look at their C-suite and their board of directors. And when you're saying that we are all about diversity and inclusion and we're very progressive, so on and so forth, and I go to your website and I read the bios, in addition to what I'm seeing aesthetically, it doesn't match with what you're saying. But I do applaud you, though, for embracing the opportunity to get to where you ultimately need to be. The reason why that's so important is the lens that you look through. It colors, it shapes the decisions that you're making from a hiring standpoint. And if you're reflective of the communities that you're trying to penetrate, engage with, and serve better, the odds of you being successful, whether it's on the public sector side or on the private sector side, are much greater. So all of this is an equity conversation. Everything we're talking about is not just about the downstream mortality, morbidity, or behaviors. It's upstream in the institutions and the systems, the structural dynamics, the policies. And the more upstream we go, that requires a collective impact approach. Private and public sector entities doing their part. Universities like USC and others stepping up, doing their part, being the catalyst to drive the change that we need to see in 2018 and well into the future. So I will stop there, but let's commit ourselves to being, that force to be reckoned with. Oftentimes we may not be the most visible, but the message that we have to share is extremely important. And what creates that energy, that power, and that electricity is just like the wind that moves these turbines forward. That should be us. So I'll wrap up there, and thank you for the opportunity.